How are you, Nicole?
I'm good. How are you?
Good. So you're thinking about having a sliver?
Yes.
All right. So what I want to do first is just kind of ask you, and I'll talk to you about, what's involved with it. But I just want to make sure that you and I are on the same page, and you know what, not only we can do, but what we can't do. So if you hold that mirror, show me what's bugging you right now.
Anytime I do my makeup, you can't really see anything that I do because my lid is so heavy.
Right. Now it looks like to me you're overcompensating by lifting your forehead up. And
Yes.
One advantage, so the sliver is basically just a little sliver of the extra skin that's contributing to falling over, crowding the upper part of your eyelid. And as you said, it makes it difficult to put your your makeup on and that kind of thing. So it's really just this little sliver right here, right along there. And I put the incision in a crease where it's very, very difficult. In fact, you won't see that incision at all. And I don't want to overdo that. We don't want to, the deer in the headlights. It's just a more refreshed look. But one other little benefit of that is by cleaning up some of that skin a little bit, you're going to have that less of a desire to try to hold your forehead, which hopefully will prevent some of the forehead wrinkles as well. So as I've told you before, it takes about 45 minutes to do. We do it with local anesthesia. We do it right in the office, and the nurses are awesome. They'll hold your hand. I don't recommend it, but some people just jump in a car and take off. I would prefer that maybe somebody drive you home, or you sit around here at least for a half hour, so make sure you're steady on your feet. But it's a pretty easy procedure to go through. And then the sutures come out at about day 6. You can expect a little swelling and a little bruising, maybe or maybe not. Some people have very little, and the sutures are very delicate and they're hard to see. And then again, they come off at day 6. Most people take nothing, or if you feel like it, you can take a little Tylenol.
Okay.
So what other questions do you have for me?
I think that's it.
Yeah, you think you understand it?
Yeah.
Yeah. All right, well, we'll go ahead and move forward and set it up.
Okay, sounds great.
That's good. Okay. Stay right there for a second. And this just allows me to kind of figure out exactly what I want to remove here. There we go. Somehow you need to get in here. Okay. Just turn your head that way. Good. That's good. I'm just going to turn your head a little bit. Sorry about that. And I mark out exactly what we're looking to. So that is where the incision is placed, and it's right in that crease, so that basically you won't see it at all. You've seen them before where it's hard to see. You really have to look for it. With the eyes open, it's virtually impossible. With the eyes closed, if you really look close, and sometimes you can see it, but that's about it.
Tight for a sec, please.
Okay.
Yeah,
Lift up your head
Just do what you
for a
gotta do,
second,
and then
and then we're going to go ahead and slide you up all the way up here. Okay, Nicole, that's good. And then put this right under her knees and put your head back. I'm sorry. I want you comfortable. I don't want that there. It takes a little pressure off your back. You see that?
Yeah.
Does that take a little pressure off your back? Good. Okay, let's bring that over here. And we'll put these, I'll take my glasses here, my bifocals, so I can see. That's what happens when you get old, Nicole. It's terrible. I'll be able to see. All right, so first thing we do is we put a little, I like ice because it really does help with discomfort if there is any. So we like to ice up the eyes a little bit here.
So you're going to stay on that side.
Okay.
So what I'm going to do here, Nicole, is I'm going to try to go very, very slowly. And I'd love it if I had a nurse that could come hold her hand, because I do think that makes a big difference. Rose is going to hold your hand there a little bit.
I'm just going to hold your hand, okay? And then you can squeeze.
Okay, and so what we do is I just ice this down before I put a little local anesthesia in, okay? And you've had some topical on there, so that helps too. So what we do is we put topical on, Marcy, and then we put ice, and it really does make the area a little bit more numb before we even start. So you get a little pinch here. Ouch, little pinch. How we doing, Nicole, all right?
Good.
That's not so bad. See, she's a mom, so moms do better than most because they put up with so much, you know? Moms are like, this is nothing. You kidding me? I gave birth to a child. You think I'm kidding? The guys are the rough ones. The ones jumping all over. Okay. A little bit more. You feel that a little bit? A little pressure, right?
Just a little.
Yeah. Okay. Do me a favor. Just open your eyes and take a big breath. There you go. Okay, you can close them and relax there. Good. Good, good, good. Are we doing all right?
Mm-hmm.
Okay, good. And what we do is after we put this in, I wait usually about 4 or 5 minutes before we do anything because it takes a little bit of time for the local anesthesia to work. And then I try to not to get any of the local anesthesia running or the whatever running down your neck or cheek or the eyes for that matter. You okay?
Mm-hmm.
He's making it look easy. Now and then we get someone here and they're jumping all over the place.
I know you're talking about me.
What are you doing now? What are you doing now?
I remember when I no, that's not even funny. Is that what I want to do?
Just feel pressure.
Yeah, a little pressure, right?
So what are you doing on the
What I'm doing is this is just a little instrument that basically allows me to assess and take out just the amount of skin that I want to remove.
Okay, so say it again, you're measuring it or you
Well, I've marked it out, but now this allows me to kind of test, measure, and assess. You okay, Nicole? Do you feel a little pinch there?
Yeah.
A little bit? How about that?
No.
Okay. Okay.
So is it a measurement tool? Is it a cutting tool?
I use it as a little bit of a measurement tool, but it's what allows us to do that pinch. I don't know.
Pinching tool.
It's a pinching
Does it
tool.
make a mark?
It does, but the mark's going to go bye-bye. See? The mark's going to go bye-bye.
And what are you doing now?
Now what I'm doing is I'm just taking, I'm going to, oh, you're tough, Marcy.
Well, I just want to make sure
I'm just
sequentially
taking, yeah.
that I don't miss anything.
No, all I'm really basically doing is use my assessment marks here and taking that precisely that amount of skin off that corresponds to the area that I marked out. And I do this in a way too that allows us to, you okay, Nicole?
Mm-hmm.
Good. And that's the little sliver. And I'll go ahead and retract upward there a little bit. This is just a little cautery. Sometimes people can, just stinks a little bit. You smell a little bit, Nicole, okay?
Mm-hmm.
All right. And this just seals the vessels. What I'm doing, Marcy, here is just doing some cautery.
Mm-hmm.
You know, the bloods are, the eyes are very vascular, so these little tiny vessels try to bleed. And that just seals everything up. And then we sew it, and that's it. And then Nicole gets to go home, and she's back on duty. Right, Nicole?
No hot milk at this.
Are you?
Mm-hmm.
I don't blame you.
Bed
You
rest
should.
for-
You should.
For a week.
Mm-hmm.
Doctor's orders.
Just I'm going to basically one little area here. I want Perfect. All right, let's put an iPad back on there. And now what I do is go to the other side and do the same thing.
When do you stitch it after?
We do. We stitch it after both of them are, the skin's removed from both sides, and I sew them both up at the same time.
I want to ask her how she's doing.
How you doing, Nicole? Good? Did you feel that?
Nope.
Little pressure, right?
Yep.
Yeah. Doesn't hurt though?
Nope.
Okay, that's awesome. Good. Yeah, I don't like hurting people. You hurt people, they don't come back. They don't like you. All the above. They tell their friends you're mean. Okay, so I'm going to do the same thing on this side.
What's that tool called?
This is called an Alice tissue forceps.
All right.
Alice.
ALICE.
Yeah.
Tissue.
Yeah.
Forceps.
Yep.
Basically, kind of marks out.
It marks out. It allows me to kind of test my assessment and make sure I'm removing precisely the amount. You okay? Okay, good. I was looking like I was you look like you were a little uncomfortable. I want to make sure you weren't. You felt that a little bit, didn't you? I can put a little bit more right there. Let's put a little bit more local right there. I can see she's feeling that a little bit. You good? All right.
I'm going to come a little closer to your face. Okay.
What's the difference between, doing this as a sliver procedure and the traditional blepharoplasty? Well, as we know, one of the things we've learned now that one of the best ways to keep youth is to keep a fuller face. And I believe that people did too much on upper eyelid treatment. And people took too much skin and took too much fat. So by just doing, and what we found is that by just taking a little bit of skin without going, taking all that fat, which requires, by the way, if you're taking some of the fatty tissue out, it ends up with, it's a little more, you need more anesthesia. So you really need to be done in a setting, okay, relax it, good. In a setting where, you can provide, and that's why we end up, having to do those down in the operating room. So, but the sliver is just a sliver of skin to clean up and refresh the upper eyes. Let me just see, open your eyes again. Okay, close them, open them, close them. Okay, I'm going to take just a smidge more of that, okay. Yep. All right, Nicole, can you open them again? Close them, open, close them. I'm going to take a little bit more right there. I don't know if you can see that, but... And I just want to come back and just take a wee bit more on that other side so that they're perfectly symmetrical.
We're going to have to interview you after, right? You're going to have a chance to get on camera so we can talk about this?
Me?
Yeah.
Sure. Anything for you.
I thought we were going to interview you before the procedure. But
No, whatever. Whatever works for you, Mars. Okay. Open. Close. That's good. Right there. All right. And you okay, Nicole? All right. At this point, you really shouldn't feel anything that hurts at all. Sometimes people feel just like a little pinch as sutures, but the area should be still pretty numb. Okay. we used to do a lot more, taking fatty tissue, and I think we overdid people, to be honest. I mean, I'm a conservative guy, and so what I've really done is just, revisited the procedure, and I do a lot less in fat removal. And to be honest, patients are happy.
Yeah.
I mean, personally, it's just a fresher look without doing a lot.
I love it.
And it's like a little perk, a little pick-me-up.
I'm trying to talk to a couple people. All right, so tell me about what is the sliver? I mean, what is that?
Well, it's basically, a little nickname that I gave a very, very a simple approach to blepharoplasty, which is just a skin-only blepharoplasty. And I think that for years, doctors tended to do a little too much on the upper eyes. I had not only tend to be conservative, but I like a more fuller, more youthful look. And if you look at most people, they don't really have a lot of, if you look at the models all have a full upper eyelid. They don't have a hollow upper eyelid. So why are we removing all this tissue and fatty tissue? So by just doing a sliver, and what I do is I'm very, very precisely marking out just the amount of skin that I can take that can clean up the upper eyelid, so that people are able to put on their makeup without smudging, and also, by having a lot of extra skin there, people tend to they walk around like this. So it overall, it just cleans things up and makes people look a little more refreshed, and it can be done in the office. I think that's the big thing.
Okay, so once again, the upper blepharoplasty, upper eyelid, that you hear that, what is that in a sentence, and then what is the sliver difference?
Sure. Blepharoplasty is nothing more than, it comes from the Greek derivative, bleph, which is eye, oplasty, to change the shape or form. So blepharoplasty is a generic term that means changing the shape or the form of the eye. That's all, simple. Now, how do you do it? So the traditional upper eyelid blepharoplasty was always done with removing skin and maybe a little muscle and a little fatty tissue. And we still do that on occasion when we have someone who has that but I would say probably 90-95% of our patients just have a little extra skin. And so simplistically, it's just the skin-only component, which I call a sliver. It's just take a sliver of skin. It can be done under local anesthesia, and it's done in the office. And that's what people like about it. I mean, I've had patients who literally sit here for a half hour, jump in their car, and go to a basketball game. Even put a pair of glasses on, and can you go where nobody knows that same day? Not necessarily, but if someone said, like, look, listen, I had a little work on my eyes, whatever. But it's much more socially acceptable. They get a little bruising, a little swelling, but it's just not a big deal. Most people go back to work. I mean, if you're in the public eye, you're a defense attorney or something, you may not want to go back the next day, but a lot of people can go, but they'll feel well enough to go back to work the next day. If they work at a computer, they do a desk job, or they, pretty much, even one of our surgeons, who I did, and back to work the next day.
What causes the upper eyelid? Is it age? Because she's younger. What is it? Is it genetics?
Well, some of it is, first of all, it's age related. Okay, so as we age, we lose some of the elasticity in our skin, so the skin stretches. So in addition to that, as we get older, our brow tends to come down a little bit and recruit skin, if you will, to the upper eye. Why in someone in their late 30s or 40 compared to 50 or 60, some of it's a little more genetic. I mean, there are people that just have a heavy forehead and just have a little bit more aging in their upper part of their face. And so they're the kind of person that maybe have it done in 40s, early 40s, or even sometimes earlier, someone who's been bothered by it.
Is there anyone that's not a candidate? And I'll ask for that first. Is there anyone that can't get it?
Well, it all comes. The short answer is no. I mean, it is an age-related function. There are times, for example, if I'm seeing someone who's 30 or 35 years old, they may not have enough skin to make it worth it.
So, all right. So, but other than that, it's
no. It's pretty much. If you can see the skin there, and the person is otherwise comfortable and can sit still, then yeah, you can do it in the office.
Any complications, contraindications?
If someone's maybe had previous upper eyelid surgery, you just need to be a little more conservative. Again, if someone were to remove too much skin, you might have difficulty closing your eye, but that's that's totally inexperienced and unavoidable. And avoidable.
Cost?
I think the fee we charge is something like $2,300 or something like that in the office, and that includes the procedure room and everything. So, and all the post-op care. It's about that. It's somewhere around that range.
And recovery and aftercare?
Days to a week. Sutures come out at day 6.
And literally, you're rolling.
Yeah, that's it. I mean, it's pretty simple.
Okay, did I not ask you something that I should have?
No, you always ask me the right stuff. No, I mean, you basically ask me it. Men, women, I mean,
All right, we can do man and woman. I mean, I didn't really ask that. I mean, are more men asking for this? Have you been doing it on men?
More men are asking for it, but still women make up the majority of our patients. I think it's more of all of the procedures we do as a facial plastic surgeon, probably blepharoplasty is the most common among men. So, it's a more common male procedure, but the women still make up the larger majority of people that have it done.
Traditional upper left takes much longer and recovery.
It does take longer. I mean, I do a sliver in probably 30 minutes. The traditional full upper lid blepharoplasty maybe 45 to 50 minutes. But the patients, it's a little more time in the operating room. The patients are sedated and that type of thing. Just go ahead and bring her up there with the chair. Good. You okay?
Yeah.
You don't feel lightheaded, do you?
No.
No? Okay. I'm going to take this out from under because it'll make your back feel a bit better. There we go. Okay. Let's take a look there. And let me just see you. Close your eyes. Open them. That looks awesome. That's perfect. Absolutely perfect. As you can see, they're right in those creases, so it's really hard to see them. And even now, hard to see them now, but when they're completely healed up, they fade right into a natural.
Okay, can you say that
ring.
again? They're right in your creases, you can't see them?
So the incisions are placed right now right in the crease there. So go ahead and open your eyes. You can't see them at all except a little bit out here, but initially, but then when that heals up, you won't even see them.
Okay,
So.
ooh, jeepers. Okay, so what I need you to do...
It feels almost like a little bit of paper cuts, but maybe you still have that local anesthesia in there. So the big thing tonight, just be careful. Don't rub your eyes. I mean, if people are real aggressive, they can rub their eyes and pop open a suture, which that's not good.
Okay, in a second, can you say, how was the surgery?
It was easy. Not very painful at all. And the worst part about it was the numbing. That's it. It feels weird. That's it.
Mm-hmm. So right now, you're just...
Yeah, I mean, I don't feel that I can't do anything. Just waiting for that numbing to wear off. That's the only funny feeling. Hi, it's Nicole. I am about 2 months out from having my sliver bleph by Dr. Williams. And he had asked me to answer a couple of questions, one of them being why I had this procedure now. It's because the sliver bleph is something that really easily fit into my lifestyle. I have 2 young kids at home. I work, and just trying to juggle the house and my family, I really was looking for a procedure that had little to no downtime. I chose Dr. Williams to have my sliver bleph done because I know he has 25 years of experience as a facial plastic surgeon, and I wanted to go to someone who is performing these procedures frequently, and I know that he is exclusive to working on just the face. I would definitely recommend my family and friends to have this procedure done, as it was easy, affordable, very little downtime. I had amazing results, and I'd like to thank the team at the Williams Center for helping me through this process, and Dr. Williams for giving me these amazing results on something that has been bothering me for a long time. So thank you very much.